Did that scare you? That should have scared you. These words should have scared you. Medication error. It sure does scare me. My name is Hannah Best, and I am a nursing student at the University of Mount Olive College. I am in the master's program, getting my master's in nursing education and administration. I'm going to take a few minutes to talk to you about medication errors. You will learn more about this in your Nursing 300 course, which you'll take very soon, and it is a course that deals with ethics and laws in nursing healthcare. This video is an assignment for me to help you, and we're just going to go over a little bit of information about medication errors and see how they pertain to me and you. First of all, there's a few objectives we're going to go over. You can read them. We're going to define medication error, which we pretty much have. We don't want a medication error to occur. It's not good. It's something that is not supposed to happen, and it could really affect a patient, affect you. It's just not good. We're going to recognize what's done when and if a medication error occurs, and we're going to explain how to prevent a medication error from occurring and discuss potential medication errors that you or I may have or been close to doing. It's very easy if we don't do everything we're supposed to do to prevent a medication error. So those are some of the objectives. So later on in your nursing courses, you will take a theory class. I'm not sure when, but one of the nursing theorists that I came across in my BSN classes and now is Joyce Travelby. She's a nursing theorist who discovered human-to-human relationship model. Her goal of nursing was to help patients and families cope with what was going on, their illnesses, and understand why their illnesses have occurred, or, more information about their illnesses and the medications they were on, just anything to do with what was going on with the patient and family. This is one thing I kind of relate to medication errors, is because, medications need to be taught, and we need to, be able to tell the patients as well as the families about the different medications that the patient may be on and information related to the medication and what is very important about the medication. That can help prevent medication errors from occurring, outside of the hospital or anywhere. It's, nursing education is very important when it comes to medication, and that can help prevent an error in medication administration. So one thing that I found very helpful for me, and I know that y'all probably already know, is the 5 rights of medication administration. And this is related to nursing administration of drugs in the hospital setting. So I'm sure you probably already all know about it, but 1 would be the right drug. 2, your right patient. Make sure you check. The right dose. The right route. The right time. Those are the 5 rights to medication administration. If we all follow those, then all the medications that we give in a healthcare facility, such as a hospital, there should be no error. We should check that every time we give a medication error. That's very important. Nursing education about a certain medication is very important to the patient as well as the family, because family, if they're in the room and they're with the patient, more than likely they are helping with their care. So we need to make sure that they understand about medication errors. The PowerPoint that I'll have for y'all at the end of this video will explain more about the nurses' rights to medication administration. As nurses, we should always have the medications provided for us to be able to give the right medication. We should have the medications ready in our Omnicells, Pyxis, by the pharmacy in order to give our medications on time and and to the right patient, because sometimes I know some hospitals deal with situations where you might not have the medication you need at that time to give to your patient. And that's a problem, because when you have a certain time and you need to give it right then and there, then if it's not there, that's a problem. So nurses have the right to have access to medications that have to be given to their patients. And you'll see more about that on my PowerPoint. And let's see what else. I think that's it. So we just need to really try to prevent medication errors from occurring, because it can be really scary. I know that a medication error has occurred to me before, or I've came close to having one happen. Being a nurse, I've been a nurse for going on 6 years, and luckily I haven't made a medication error, but I have came very close to it. So it's just not fun, and it's just a really eerie feeling, and you don't want that to happen. So taking time and really knowing your medications and following the 5 rights of medication administration is very important. Thank you. Put my mask back on. Right.